Welcome to everyone to the results grassroots call for April already. Yeah, I'm sure more people will join over the next minute or so as usual. So huge welcome to everybody. Hope you all had a relaxing Easter break. It's lovely to see you all. For anyone who's it's their first time on a results grassroots conference call, a special welcome to you. So my name's Naveed Chowdhury and I'm the head of campaigns at Results UK, and I chair these regular Tuesday calls. So it's the first Tuesday of each month, and obviously we share what you've been doing around the country on your advocacy around the UK, discuss the latest advocacy action, and hear from an expert speaker on the topic. So as usual, I'll start with the housekeeping. Please do keep yourself muted during the call, and if you've got any questions or comments, we can try and deal with that through the chat. Closed captions are on. You should be able to turn them on or off yourself using the Zoom toolbar. And as usual, we're recording this call. So if you'd prefer not to be visible, please feel free to turn your video off. Would anyone like to just introduce themselves, say hello, particularly if you're new? It's not. It's an option. It's not compulsory. Mostly familiar faces, but welcome everybody, old and new. So as usual, has become usual, we'll now keep this call open after the formal end of the meeting at 9 p.m. for up to an extra half an hour, should anyone want to stay and chat, but of course that's also optional. So I'd like to start by our normal review of what's going on this month on global poverty issues that Results advocates on. So the first thing to say, I suppose, is that we're still being kept on tenterhooks about when the UK's general election will be. There have been hints that it might be pushed back to later in the year now, but there are still plenty of people predicting an early summer election. So please do note that our February grassroots action, which was on contacting your prospective parliamentary candidates, or PPCs, is still very much a live action. And we'll link to those materials in the chat box for those who haven't seen them. We have also run a training event on this topic on the 13th of March about how to contact your election candidates. So if you prefer to watch a video rather than to read the text in the action materials, then we'll be linking to that recording there as well. So you've got a choice of two ways of learning more about that activity. As always at election time, we together with other organisations like us, we always hope to get manifesto commitments from the main political parties about the issues that we work on. But this time we know that references in manifestos to international development are going to be very slight indeed. In fact, in the ones that are published, there's almost nothing. However, BOND, the umbrella organisation for international development organisations in the UK, of which Results is a member, has released its own manifesto called A Global System for People and Planet. And Jill, who's on the call, formerly of the Stork Valley Group and now in South London, has written an excellent article about it, which has been published in the magazine Independent Catholic News. And again, we'll put that link in the chat if you want to read what Jill's written and also find out more about the BOND manifesto as well. So it sets out the things that we believe need to be done by the government, whoever wins the next election. And, you know, many congratulations to Jill for a very powerful analysis of why this matters. Next, I'd like to report back on all of the activity that happened towards the end of last month around World TB Day on the 24th. And we'll shortly, I'm sure, be hearing from you about all of your work around the country to highlight this that moment. The first thing we were very pleased with is a campaign win. So on World TB Day itself, the government committed a sum of £4 million towards funding innovative projects to end TB, and it's called the TB Reach programme. This will help test new approaches to increase the number of people diagnosed and treated for the disease in low and middle income countries, providing health services for 500,000 people, detecting cases of TB in 37,000 people, and saving more than 15,000 lives. And the link to that announcement, that very, very welcome announcement, is going in the chat now. So pat yourselves on the back if you've been part of TB campaigning in recent years or ever. It's a great, relatively small sum of money by the standards of some of the things we asked for, but really, really good news. Now, on the 20th of March, just a few days before, as you might remember, the World TB Day was actually on Sunday this year. Results hosted a World TB Day reception in Parliament. We had a number of speakers, including a very powerful speaker who shared her experience as a person who had been diagnosed and treated for TB and suffered stigma as a result from health professionals and the general public. We also heard from politicians and health professionals and some grassroots volunteers. Kush, Lucrezia and Stephanie were also at the event. And lastly, as mentioned last month, Sahira, who I think has joined this call, our senior TB policy officer, has written a report on the aspect of stigma attaching to TB patients. And that report was also launched at the event, and you can now find it on our website. Someone's just posted in the comments about the figures. So yeah, we can share the figures. The figures that I just mentioned about the numbers of people reached by TB Reach, they are in the chat and they are in the government announcement that we just posted a link to. So we are also going to post, as I said, Sahira's new report. And we're also, put together, or Jess, our communications person, put together an Instagram post giving a flavour of what the event was like in Parliament. It's a little Instagram reel, a video, which kind of shows people actually getting together, talking to the politicians and hearing about this topic. March the 26th saw another important anniversary, the 4th anniversary of the COVID lockdown in the UK. This somewhat somber milestone was marked by a blog from John, our policy coordinator at Results, and again, we'll put a link to that in the chat as well. The blog focuses on the lessons that we should learn from the pandemic and discusses the efforts now being made to combat so-called Disease X, which is the name, if you haven't heard about it, being given to the next infectious disease with pandemic potential. So obviously, by definition, we don't know what it is yet. It's a great read and I highly recommend it, and it explains really clearly why the world needs to accelerate efforts towards the so-called 100 days mission. So that's the process whereby we can develop and roll out treatments for new pandemic diseases within 100 days of it being identified. And I know that some of you on this call have worked on that issue as well in recent years. So that's it from me. We're just going to do a roundup now, the usual roundup from those of you around the country, hear about your activities before we introduce the speaker. So I'm going to hand over to Aurora in the normal way.
Hiya. Hi, everyone. It's really nice to see your faces. So I'm Aurora. I am the campaigns coordinator at Results, and I'm your go-to person for anything you need, anything you want to do in your groups, any ideas that you have, but also for to let me know when you have taken action so we can celebrate it together here. Now, I really like kind of this new approach we've been trying to, rather than me telling you what you've been doing, maybe you can share with everyone else some of the things you've been doing, and anything that's not covered, I can then pitch in. But yeah, I just wanted to open up and see if anyone wants to share what they've been doing in the past month, maybe a letter that they wrote, a meeting in their group, or any other activity. So yeah, over to you, really.
Hi, it's Pete.
Hi, Pete.
Good evening, everyone. It's lovely to see you all. Just to say, I sent a brilliant letter to Kemi, and she hasn't replied. And Jill, my sister at a distance, had asked me to, or advised me to actually phone up her office, which I did, and they haven't replied. I just thought I'd let you know. Bye.
Well done for your brilliant letter. And MPs, not the easiest people. Sometimes we need to be so persistent with calling them and insisting for them to reply, and even then, and it's their duty, isn't it? How about you, Jill? I know you've been up to quite a bit.
Well, I had the same thing with my MP. It's a new MP for me as I've moved into the area, and the email that I got acknowledged received it said if you don't hear within 2 weeks. So I took them at their word. I phoned the office and then I followed it up with an email 5 minutes later. And within half an hour, I got a reply from the MP, a really, really good reply, saying that he'd written to Andrew Mitchell and he was very committed to all that, and it was a really good letter. So it does pay to follow them up. Keep on following them up, because I thought, well, if I don't hear anything, I'll ring them again, you know, and go through the same thing until I hear. But I didn't need to. So that was good. And I also had another article in Independent Catholic News for World TB Day, and I've put a link in the chat box.
Oh,
there.
sorry.
Okay.
I also had one prepared that to put, so I put that there double, but that was a really good one. Well done, Jill. I recommend you guys to read it. And can I ask maybe if Helen and Reg want to share about the meeting they had in Poole and the plans of having another one?
No.
Oh, sorry. Oh, there you go.
Yeah. Well, or we had a meeting. We didn't actually come to any final decisions until we got to the point where we decided that the best way to do it would be to go away and discuss or think about what we've been discussing, and then to meet again. And we're going to meet this coming Saturday. It's called a planning meeting. We are now into April, but we are persevering, and we're going to. I think where we came from was the fact that when we looked at what we decided to do last year and felt